Hi, everyone. Good afternoon. Welcome to Pink Mike Legal Confessions. I'm Stephanie Garces Donay, owner of Garces Law Firm, where we help prepare for the unexpected. Just so that you are aware, today we're talking about something that's not law related. So that's kind of nice, taking a break for some of the stuff I always educate you guys on. But today's episode is specifically for addressing work from home environments, specifically work from home burnouts and mental health challenges. I think this is something that is not talked about enough. So I wanted to address it today on our show. So, as you all know, over the past 2 years, there's been a pandemic happening, of course, that has really turned the lives of working professionals upside down. And I think for most of us, really learning how to navigate and how to figure it out professionally, but also at our home life, is always really interesting because everyone has their own ways of thinking through this, and sometimes it feels like it's over, but it's very much still going on for some people. Now, I know at some point parents had to learn how to homeschool your kids and actually do working remotely on top of that, or even having the children at work um, say work from home with you because they're in school. So the long and the short of it is that there's long drawn out hours that have taken place, back to back Zoom calls, which meetings and conferences, and I think a lot of this is still going on. But really, the inability to take an actual vacation, I think, it really has begun to take its toll. And while things are opening up, and yeah, people are traveling, today's mental health issues and burnouts are at an all-time high. And the world has been forever changed with the pandemic, right? We're never really going to see the world the same way. And so the reason for that is because a lot of us haven't lived through this. If you ask your grandparents or something, they may say, oh, yeah, we lived through the pandemic. But for most of us, this is our first time. So there is a lot that has changed. And in this week's Peak Mike Legal Confessions, we're discussing the future of self care, work life balance, if there is one, right? And mental health management. So, really, we just want to make sure you're tuning in today to understand what this is about. So, as I mentioned, I'm very passionate about today's topic because, as a business owner, a dog parent, and a spouse, the demands of life are always pulling us in different directions. And quite frankly, I think most of you can agree with me that the demands in life have really always amplified during this pandemic because it's hard not to. Things are really different than they used to be. And now we're finally in a place where employers and the healthcare professionals are taking note of what are the actual lasting impacts that have come about since this pandemic, especially for mental health concerns and really just your own well being. You know, they always say if you can't take care of yourself, you can't take care of others, right? I'm sure you've heard that. So today's focus, as I said, is work from home burnout and mental health challenges. Now, just so that we're kind of giving a bigger picture of this, there are two key areas we're going to be covering today. And working from home burnout is one area. Everyone knows what that's like. I mean, as much as we all want to work from home, for those of us that are like glued to our screen, Zoom calls back to back, it could be a burnout. There is such a thing. And whether we want to admit it or not, it's not super easy to get through this. And it's always good to talk about these things because I think now we're at a point where some of us are doing hybrid. Some of us are working from home some days, and others are going into the office. Other people and employers have chosen the option to go fully in person and not so much remote. And mental health issues is the other topic we're going to be covering, and related to a change in lifestyle. So a lot of times if you have a Twitter account or you're into hashtags, you'll see hashtag WFH, and you'll see hashtag mental health. So for those of you that know what I'm talking about and are familiar with these hashtags, these are like newer hashtags that have arrived in the scene. So if you'd like to share them during this episode, feel free. But I do think that not enough of us talk about mental health issues and really just what working from home burnout looks like, and really maybe just the demands that you've felt since the pandemic. So let's start with the numbers, right? A lot of this stuff is based in studies. There's been a lot of studies around mental health and us as a country. What have we been doing with our workforce? What are the struggles that people are facing now than they didn't have before? That sort of thing. So when we talk about these things, we really want to focus on really just how do you adapt? How do you continue? at a pace that's required to work from home when you have all these other things going on. So this is a $1 million question. I think a lot of these studies are looking to focus on. But as I mentioned with burnout, so did you know, just a fun fact for all of you watching, is that 9 out of 10 employees are concerned about their burnout levels. Now, this is really interesting to me because when you think about the way that employees are, tasked at work and we're expected to do everything and always be healthy, I think a lot of times the discussion of burning out and really just trying to understand how burned out you feel and what to do is really important. So there's different pathways at work, and really pathways in a workplace when it comes to reporting someone's mental health. And 9 out of 10 employees being concerned is the study. I mean, that's 90%. So that is a lot of the majority, I would say. And, for those of you that are watching, feel free to chime in on what you see in your workplace and things you have done to cope with it, because it's really an open forum for people to think about the studies that are out there. So to me, it's really interesting because I think a lot of people underestimate the power of social media and the power of using these platforms so that we can engage in discussion. I mean, it's nice to think that we're all human and all of that, but most of us have challenges that we face and maybe we're not open about it. So if you feel like you're alone, you're not. There's obviously a majority of the people that do feel there's burnout at the workplace. So that's really interesting. And another thing too is over half, I think it was half, what the survey said, half of survey respondents experienced burnout in 2021. And by the way, this is up 21% from pre-COVID surveys. So that is a pretty big amount for it to be going up, because keep in mind that employee burnout has always existed, but I think things have been amplified much more than normal because we have these unprecedented times, is what they call it, right? The pandemic, we've never really gone through that. So, and I don't know, maybe I speak for myself on this, but I think sometimes because we've been remote, it's almost forces you to do more because you feel that you can be more productive. I know I've heard people say, oh, I don't have to travel to work to and from, so that saves me 2 hours. But correct me if I'm wrong, but I think that some of the employers demand more from the employees, and they want more. And so sometimes those 2 hours that you would have to travel are now being used to work. So like I said, you do see an impact in the numbers. You see a lot more people that are having these outcomes of higher burnout rates. Another thing that we want to discuss, is part of this is also just depression. That's one of the mental health struggles that a lot of Americans face. And 29% of employees describe themselves as depressed during the COVID pandemic. So that is a pretty big number. If you think about COVID and all of the sad stuff that was going on with it and still is, I would say 29% of your employees are feeling the stress. They're feeling depressed. And these are just people that identified it, by the way. I mean, we keep this in mind when we talk about this, but these surveys are basically based off reputable places. I think Garter HR study was the one that I'm referencing, but they talk about it in the sense of that. That's what's been reported. Keep in mind that there's a lot of people that go undiagnosed, right? But for purposes of statistics, that's what you're seeing there today. I've also seen another study that talks about, I think it was over 70% of the employees reported some concern and really concerns with their depression levels, mental health levels in Q4, I think it was, in 2020. So really, there's different things to discuss here. I mean, mental health and burnout, all of this goes on in the same spots, even though we're talking about it individually, people are facing these types of things. So it's always good to know that there are resources out there. And I know during this live, you're going to see a couple of the links in my chat here that talk about some of the stuff that's available. If you are struggling or know someone that's struggling, even sharing the video really helps. I mean, people want to know, where do I turn? And some of this is private. Not all of us want to boast about our mental health and what's wrong with it or what we think is right with it, right? Because sometimes people don't even don't even want to admit it. So it's good if you feel like you know someone or you've experienced this yourself that is struggling with mental health, feel free to reuse the sources that we send and also share the video. The other thing that I wanted to discuss is, as far as numbers, is engagement. So the percentage of actively disengaged employee will be up 15%, I think it was in 2021. So it's kind of interesting because disengagement is a funny word to me because it basically it's like for every employee, and I say this as an employer, for every employee that is working from home, there is someone out there that might think you're disengaging. You're not actually, actively participating in some of the meetings, or perhaps not even talking. I mean, it's kind of interesting. I know some of you have probably done this, but when you're in a Zoom call, there's always someone that doesn't have their video on, or maybe there's someone that is, not talking much, and maybe they're dazing off. So there's a little bit of different etiquette when it comes to the Zoom calls, but the percentage of actively disengaged is actually up by 15%. So that's very interesting to me. Another thing that should be discussed and really considered when we're talking about this topic is substance abuse. So just as a statistic, 36% of workers say an addiction or substance abuse issue has affected them more since the pandemic. So this is pretty self-explanatory. I think that people that struggle with substance abuse, obviously, when you're at home and, most of us were working from home, everybody was stuck inside. And for some of us, we still are working from home. Substance abuse is still on the rise, and especially during the pandemic. So to me, it's interesting that workers are actually reporting having more struggles and actually feeling that it's affected them more because of the pandemic. So these are really important topics to discuss. And again, resources are available, and they'll be in the chat as we're sitting here. So the other thing about substance abuse, another study that I came across that was very interesting, and I thought I should share it, is that 1 in 4 employees is concerned about substance abuse levels. So many people that suffer from substance abuse will, have their own struggles. Some of people don't really want to recognize it, but I think the fact that 1 in 4 is actually concerned shows you that at least a quarter of people are concerned. They're thinking, okay, with everything going on, maybe there's more reason to engage in something like that. Or perhaps they just need the resources. They need to get better and they don't know where. So again, always looking to help. We obviously can send you to the right place, but I am not a counselor. I am not out to be one, but I definitely know there are resources available. If you are interested, feel free to message us. But keep in mind too, that when we're talking about these statistics, they're just to provoke thought. So a lot of these studies that exist, I mean, there's countless of them, really shows you the times that we're in. It shows you that people are concerned that there's studies being done because they want to make sure that people are aware that you are not alone in this. We are not alone. All of us have felt one way or another that the pandemic has really changed our world in many ways. And lastly, the other thing I wanted to discuss is access to mental health programs and benefits. So 53% of employees and, employers added mental health to their programs and really just to address specifically COVID-19 concerns in 2021. So this just shows you the transformation of some of the employers that are recognizing that there is a need to have access to mental health resources, to actually let the employees know, hey, if you are struggling, here's where to go. Because I think maybe generations before us didn't actually go through a pandemic. Maybe mental health wasn't as accessible or as popular as it is now. So 53% of employers offering this as an addition to their health programs is interesting, because this specifically says it was added. That means it wasn't there before. So over half have now included it, and quite frankly, it's a must. And it's just wonderful to see that the employers are acknowledging this. So if you're watching and you're wondering about if your employer offers it, it's very likely they do. So just something to keep in mind, because clearly people have added it to their programs if they didn't have it before. The other thing that I wanted to discuss regarding access to mental health resources is that 72% of employees want employers to champion mental health and well-being, but 63% think their workplace is unhelpful. So, this hits home for me because I feel that I am an employer myself. So I always like to I wonder maybe in value what the employee says. So to me, 72% of employees want mental health to be championed, meaning they do want mental health to be taken seriously, the resources to be there, for it to be a prime focus of some of the stuff being offered as benefits. So it's very interesting because if you think about it, this is a more than a majority of people, and again, it's not talked about enough. And I think very commonly now, I know that people will ask during interviews what kind of benefits are offered, and maybe that's something that employees we have to now, ask when you're interviewing, what kind of mental health um, resources are available if I work for you, So it seems to me that there's going to be a trend in that direction. And that's not necessarily a bad thing. It's just because I think the times and with everything going on, with the pressure that everyone is under to perform well at work, to get through this pandemic, to take care of their families, it's all going to come to light in some of the ways that things are trending. So it's very interesting to look at some of the studies because to me, it's the writing on the wall. These studies speak for themselves. But again, it's just good to share this because not everyone understands how serious mental health and burning out through working at home is really seriously. Um, so what exactly is work and actually specifically home burnout, working from home burnout? What is that? So for those of you that are just watching now, we are talking about what is really the impact of working from home, what kind of burnout can people face, and what are some of the emotional and mental health issues that arise, not only from burning out in the workplace, but more so during the pandemic. This is still going on, so people are working from home or there's a hybrid, so we're talking about that. So, if we talk about burnout in general, I think everyone has an idea of what burnout is. But for those of you that are thinking about how it could work in the workplace, is burnout is really identified as the lack of motivation for prolonged periods of work. So this also limits you. I should say, you have an inability to travel for vacation, for example. And you have a hard time stepping away. Uh, that's just kind of a very nice summary of the word burnout, but really it's all those things. So having burnout, I think, is pretty clear once you feel it. I mean, I think the best thing of like not being able to step away is something that I think a lot of us have struggled with, especially if you have high demand at work. But that is one of the say characteristics of burnout. So something to keep in mind. And Zoom fatigue, that's the other thing I want to talk about. That's another thing that is causing a lot of burnout with work. But specifically, Zoom fatigue is now a thing that people talk about, and it's very common because for most of us, Zoom is still going to be part of our lives for many years to come. But many meetings are conducted on Zoom. Anything from just your recreational hobbies that are outside of work. Like I know I'm with different organizations where everything is still via Zoom, and then we have as far as like work and in person versus virtual appointments. Zoom is still part of that, and even internally, I know sometimes with staff will Zoom. So Zoom fatigue is very, very it's interesting and it's also very relevant. Um, First, just so you know, it's unhealthy to be on video for that many hours in a day. I think right now people are averaging 8 to 14 hours on Zoom. For those of you that are back-to-back Zoom calls, that's not hard to accomplish this many hours in a day. Not to mention the pressure to control from your work from home environment, keeping the kids settled, keeping them occupied, maintaining a home office, but also trying to be productive. So all of that really comes to light when they talk about Zoom fatigue, because Zoom fatigue, I think, is for most of us that we felt it. It's terrible. It's like you don't have any room in the day. And even though you're at home, there's still a struggle to get through it. There's still a struggle to get through all those calls because you're tired. And staring at a screen for that many hours just can't be easy. So that is basically how working from home creates burnout, especially virtual meetings too. And when we talk about burnout, there's also this mental and emotional, issues that people are having, and even illnesses. So one of the things that comes up a lot when you look at some of these studies, it talks about isolation and loneliness. So when we work remotely, we don't get the face-to-face interaction. We don't get to see expression all the time. And like I mentioned, some people even turn their cameras off, which you know who you are, but you turn your camera off because you're hoping that you don't have to be, looking at anyone or the presenter or whoever. But the point I'm trying to make is that the face-to-face interaction is eliminated. We're so used to that, but now it's totally normal to be, on a virtual call. And even right now, as I'm sitting here on the Facebook Live, I'm staring at my computer and hoping that you can all still hear me. But the point is that there's isolation and loneliness associated with working remote. So it's very interesting to think about. And I think that does lead to some mental health issues if you're completely isolated all the time. For those of you that are introverts, you might say, I always want to be alone. But humans always need and crave social interaction at some point. So it could really be lonely. As I mentioned, substance abuse has been a really popular topic that's come up during the pandemic because for prolonged periods of isolation, and if you're home all the time and you're close to some of the things that are destructive, that does lead to destructive behavior. So substance abuse, for example, alcohol consumption has alone rose 60% during the pandemic. I mean, good for the people that make alcohol, but it just goes to show where we're at in a society. People are drinking more, and I'm not saying that you can't drink in moderation. I'm just saying the numbers speak for themselves. So alcohol consumption is up 60% during the pandemic, and not to mention too, I think substance abuse and all of that also should be taken seriously when we talk about these things, because that is how it happens when you have isolation, loneliness, and then you're off doing destructive things. So that's really, really one of the things that comes up a lot in some of these studies when we talk about burnout. Being distracted or really not motivated, this could be an issue down the road. So when we talk about employer resources, the employers have begun offering more mental health benefits than before. You heard me say it earlier that there is an increase in the amount of benefits of mental health that is being offered than way before. They're even added to the programs. Those of you that are wondering, where do I look? Where do I make sure that I can actually have access to this if I need it or if someone I know needs it? You can always ask. Employers must support employees and protect their jobs when they or their loved ones are going through a difficult family situation. So there is a law that protects anyone dealing with personal issues, especially when it comes to family issues, where you may seek help. So definitely ask the HR department if there is one. If you're in a smaller business, ask the owner. The owner would know if there's benefits that are offered as far as mental health. And sometimes they'll even put you in touch with the broker that does the insurance themselves if they use a third party. So a lot of times that's how you can handle that. Free and inexpensive resources exist. For example, it's always, a step in the right direction if you can at least consider this if someone needs help or if you need help to give them a call. But when it comes to Mind and the mental health charity, most of us have heard of the Mind. But as the UK's leading mental health charity, this charity specifically, they offer a plethora of resources and really for those seeking more information or support or guidance with their mental health. And there's different types of resources. For example, they have YouTube videos and workplace guides for anyone looking for that. And it has some fascinating research and advice about where to get help and treatment options and advocacy services. So if you're interested in that, that is free. So it's free to access, and you can visit them at their website. It's called Mind the Mental Health Charity. So I think it's also known as mental health at work for employers. So again, this is free resources, and I'm just going through them for those of you that may be interested in learning more about some of the stuff that I'm talking about and really where we grabbed our information from. But there is something else that's free and inexpensive. It's called Living Life to the Full. It's a free library for online resources and courses to teach life skills, really aimed at improving your well-being and resilience throughout your life. I mean, this is amazing because to think that that's available, just it's a library is phenomenal to people that really need it, or maybe they don't know where to turn. But this is free, and there shouldn't be any issue about where to find them, because you can always message us if you need the website. But this is actually interesting because whether you have a living a current like long-term condition that you're experiencing, or you have anxiety, like low mood, and high stress situations, it's kind of nice. I mean, even they even talk about like if you're a new parent and you really don't know how to handle that. Uh, Living life to the full has been created actually by experts in the cognitive behavioral therapy space. So it's kind of interesting when you think about some of the brainiacs that are behind these operations, because they're free and they're really meant to help your well-being. Or again, if you know someone that might benefit from it, it's great to offer that. The NHS is also another resource I wanted to point out, that's created several free to listen to audio guides on mental well-being. So this is really designated to help somebody's mood who's listening in on it. There's short guides that are created by doctors, and really everything from like how to cope. Coping mechanisms, I think, is really underrated, and how to find out how to cope with something. And when I say something, it could be any life event, anything that you're struggling with, from low moods to depression, anxiety, etc. Really to just train you and give you the confidence building that you need to be able to tackle some of these. And that is free. That's called NHS Audio Guides, and it is free to anyone that's interested. There's also Headspace. This is another resource that I know is, I think there's a free 7-day trial, and then there's a monthly subscription that's less than, I think €5. I think it's because I think it might be, overseas. But but the point I'm trying to make is that Headspace is actually an online portal, and it's also a mobile app that provides meditation. For those of you that meditate, I know it's really popular among some of my friends that meditate, but also mindfulness techniques for any scenario. Mindfulness, I think, has to be practiced, by the way. So if you're not sure what that is, feel free to check them out, because it's quite interesting how your day can get better if you practice mindfulness. But that's a conversation for another day. So whether you're really trying to have, peaceful sleep, or trying to doze off into like a relaxed state and be more present, it's a great way to learn more, because Headspace actually has like techniques for day-to-day stressing, worrying, and it even offers like a comprehensive library for guided meditations, animations, I think mindfulness workouts, I think that's what they call them, and some articles and videos that are really, really great. So if you're looking for something like that, do it. And for those of you that have an Apple Watch, the next thing I'm going to talk about, and you may very well be familiar, I know I've used this so many times. There's something called breathe sessions, or they call it like practicing mindfulness too. They actually have two. But Apple Watches have this app, or it's built in, this breathe app that basically encourages the user to basically set aside a couple of minutes out of the day to think about something that really takes their mind somewhere else that's positive. So it really is a way of practicing mindfulness and practicing breathing, but the breathing app comes standard with any wearable device anyway. But it sounds really simple, right? I mean, I've done it myself, but the cool thing about this is that mindfulness breathing really has been shown to be effective at reducing anxiety, helping with burnout, providing types of relief for pain, and really decreasing negative, pessimistic thinking. And I think all of us could really benefit from doing something like this, because I know for me, even anyone else that's in the you're working 9 to 5 or longer, you know what it's like to feel stress and to feel the demand of the workday. So using this breathe app could be really great, because it actually forces you to essentially breathe, and it makes you think about something. I know sometimes if you look at the watch, it'll say, make sure that you think about the last time that someone made you feel good, or something like that. So it makes you think about something, and it's really great for the mind. So it's free if you do have an Apple Watch, or if you don't have one, there's more reason to get one. So you're welcome. The other thing I want to talk about is there's the meditation, good old 10-minute meditations that you could put into your day. So I know that we all have busy, busy days. We don't even feel like we have time for ourselves, but often finding the time to take some moments aside and really feel that what we're doing is for us, and to feel that there is, time to set aside and to take care of yourselves is a great way to practice meditation. So I know it seems impossible for some of us that are super busy and don't even have time to breathe, but Calm is an app that actually leads you to do this, and it's a sleep and guided meditation that is actually developed to be free to access, I think, through YouTube. And I think it's even called 10-minute meditations. But so you do get it for free on YouTube, just so you know. But there is a daily calm series. It's in basically an accessible entry point to meditation. So the short dedication of the time needed demonstrates why they have really acquired so many viewers. And I think it's 500,000 views since April of 2020. So Daily Calm is free. And as I mentioned, a lot of people have subscribed to it. So feel free to look at that if you're looking for a place to meditate and really just looking for more guidance to exercise some of the stuff we discussed today. So, as I mentioned, for some of you that are just joining us, my name is attorney Stephanie Garces-Donay. I'm the owner of Garces Law Firm in Palatine, Illinois, and we help parents and individuals prepare for the unexpected. We prepare legacy plans, we do real estate closings. We also secure people's financial futures and build wealth through real estate. So, whether you're an investor or a first-time home buyer, you're acquiring more, we're here to help you any step of the way. Now, as I was discussing, our topic for today is work from home burnout and mental health challenges. So, thank you so much for really tuning in today, because I think today we really tackled something that a lot of us are afraid to talk about, and we don't want to be judged when we talk about it. So I made a pink mic for you so you can share it with your family if they're ever wondering what is it that's out there and why do we care about mental health and what does burnout look like, right? So thank you so much for joining us. We join you here at 1 o'clock on Tuesday Central Time to just share tips and to use our platform to provide legal guidance any way we can to parents, guardians, and home buyers and sellers. So, as always, our viewers have questions. And actually, some of the questions I've received before wrapping up today, I want to tackle. So, one of the questions that came in while I was doing my live is, what are some of the ways I can help myself cope with working from home? Specifically, really with burnout. So, the best way I always say is really just organize yourself, put together a routine. I think routines are really, really underrated when it comes to our daily lives. A lot of people that are successful, you'll see, and I say successful not so professionally, but also in their home life, they're happier if they can put it together a routine where they put aside time for yourself. So whether that's meditating, whether that's working out, whether that's I'm going to, read, positive affirmations and drink my coffee for 10 minutes. I always say, and I've always said it, it's 1% better than yesterday. It's all you're expected to do better. A lot of times we're hard on ourselves about this. So just keep in mind, all you have to do is 1% better than the day before. And I think you're on a good track, right? So put together a routine. That is a great way to do this. You also want to get outside. If you don't get outside during the day, that could really mess up your feng shui. I think mentally, we all need mental breaks. Let's be honest. All of us can go, but eventually your mind tends to, you get writer's block or you have like a jam mentally, and getting outside and walking around with your dog, your kids, or just going to a nature preserve is a great way to just relax and do something a little bit more relaxing and not as demanding. Take intentional breaks. I know, taking breaks, I think, is really hard for some people, because some of you are probably watching and saying, well, I don't have time for a break because I have a newborn, or I don't have time for a break because I have to be on calls all the time. But even just, going outside and taking a walk. I know for me, there's a mailbox that we go to go drop off mail. It's just a walk across the street, but that's an intentional break, thinking about when can I get up, stretch my legs, walk, go to the water cooler, come back, little things like that. And making sure, maybe you don't look at your phone for 10 minutes. That's an intentional break. Try not to eat at your desk too. Eating at your desk is super popular. I think most of us do it. But if there's a way to avoid it, go to Starbucks and grab a sandwich or something. And maybe that will be your lunch as opposed to eating at your desk. That does avoid, working from home burnout and actually work burnout as a whole. But specifically at home, eating and working and all in the same space can really create higher stress. And it's okay to turn off your computer and leave work. Okay. So that's one of the things that I learned over the years, is that I can work myself till all hours of the night. But if I turn my computer off and I leave work and I've accepted that there's more work to be done tomorrow, that's the best thing you can do to try to, create some sort of boundary for yourself. Because I think it's really easy to blend the lines between not having boundaries professionally and also, not having a boundary with your family. So you don't want to put yourself in a position where you can't, turn off the computer and leave work for the day. Leave work, I say, because you're working from home. But you know what I mean. Another question that we got that was a really interesting question because I never even thought about it was, can I be fired for taking time off to seek help for a mental health condition? No, the answer is no to that. I mean, most times people that are struggling with mental health issues, and as long as you can take the time off, or sometimes you even have to tell your employer that you're having some problems. There is no reason or justification for just letting someone go over that. It's still considered a in health issue, so I would say no to that one. Is it normal to want to change jobs or to feel unhappy in my role if I'm burned out? I think so. I mean, I think it's very normal to feel that way. As I mentioned before, when you talk about burning out and mental health, I mean, everything is correlated. So if you're not okay here in your mind, you may not be okay in your workplace and what you're actually, the happiness that you're feeling with the work that you're doing. So I think it is normal. And I think that speaking up about it is okay, and talking openly about some of your options you have to try to seek help to before you just want to change your job all of a sudden is a good thing to do. So I think it is normal. I don't think it's talked about enough. Another question I got is, if I speak to HR about programs available as a benefit, is the conversation confidential? Absolutely. The HR department really has no right to just be dispersing your information, because when you're an employee, you're just inquiring. You're inquiring on the program. I don't think there's any harm in doing that. Typically, the HR department is trained and they have a duty, right, to everybody to not go and air your dirty laundry or ask people about what they thought about what you're doing. I mean, that doesn't happen. I mean, I hope that your HR department isn't doing that, but typically, no, they are not going to be spreading it because it is confidential information. And last but not least, for us, we always are offering still virtual and in-person appointments. So whatever you're comfortable with, we're comfortable with. We do have hand sanitizer and masks. We do offer Spanish speaking consultations, and also English consultations for those of you wondering. But you can always contact me by calling or texting our number. We get plenty of texts for those of you that are super busy and can't get on the phone. And you can always visit me on my website if you're ever looking for some help or have any questions about anything we discussed during any of our Pink Mic. You can always reach out. So I want to thank you all for joining me as always. It's always a pleasure seeing the same viewers and some of you that are constantly supporting us. So your questions are excellent. I really, really do appreciate them. And I invite you here to join me next week at 1:00 for Pink Mic Legal Confessions. We'll tackle another topic, and you'll get to hear a little bit more about what we have to say on either a legal topic or a non-legal topic, which seems to be more popular. So feel free to share this with your parents, with guardians, with anyone that you know that may want to know a little bit more about resources available for those of you struggling with mental health issues or burnout from work, especially working from home. So I hope you all stay well and have a great day. Thank you so much, and we'll see you soon.